FUT, which is where they take that long strip that they cut out of the back of your head and then implant the hairs from there, which, you know, usually doesn't work a lot of the time.
Whoa. Wrong. FUT works very well. FUT works great. And if anything, we're doing a reaction video. I got a hair transplant for my receding hairline in Turkey by Brett Maverick.
Surprise! I am getting a hair transplant. Yes, I am here. Some of you guessed it, in the beautiful Istanbul, Turkey, and I'm getting a hair transplant.
Let's see if he goes into the reasons why he chose Turkey. The most obvious reason for why people go to Turkey for a hair transplant is low cost. They can get it for cheaper than in Europe, than in the States. Some people choose it because there's a specific clinic that they heard about, that their friends went to and had a good experience, had a nice result. Some people feel like because they're doing such high volume that it's got to be great, and I don't think that's absolutely true. But of course there are some excellent clinics out in Turkey, just like in other parts of the world.
Brett, your hair is not even that bad. Why are you getting a freaking hair transplant?
Well, I actually agree with you. I'm looking at myself in the viewfinder right now, and my hairline actually looks pretty good, but I assure you, it is not this good. It's just kind of like an optical illusion, I think, from the lighting. This is what my hair looks like on any normal day with normal lighting.
I mean, it's not an optical illusion. I mean, overall, he has nice hair fullness, especially in the frontal forelock. It's just that he's noticing more of a recession in the corners, which is quite common, and he's looking to kind of close that off a little bit as to sharpen that hairline. What he has on his scalp otherwise is looking quite good.
I kind of noticed my hair receding at the age of 19. And like any 19-year-old would do, I panicked, I freaked out. I thought that I was gonna lose my hair in like 6 months. Luckily though, it's been a very slow process.
It's common for androgenic alopecia to start in teenage years, actually, something that oftentimes people don't recognize. And when you're young, you're not really thinking about it, you're in college, you're hanging out, and we might start seeing it, but you don't even know who to turn to for advice or what to do, so most people just leave it alone. And then sometimes it's a little bit too late when you've waited 10 extra years and you've lost a ton of hair.
The topical treatments, the scalp massages, these type of things. And I think it actually did work quite a bit to help stop the receding hairline. And I actually made the decision, you know what? I'm not gonna get a hair transplant.
Other than scalp massages, I'm not sure. He said some topicals. I don't know what exactly he was using. It'd be nice to know which regimen he's on exactly.
It was a great opportunity, and why not jump on that opportunity to get my freaking hairline back?
Sounds like the doctor wanted to promote his clinic, which, you know, I can't blame him for that. We're all trying to do our own form of marketing. I would love to make sure that Brett is on some medical therapy, because the biggest thing for him, I think, just based on, you know, looking at his hair now, is to preserve what he already has. I mean, the transplant to augment the corners is fine, but if he were to lose a lot more of this hair, it wouldn't look as great, and then he'd be chasing that with more and more grafting over time.
Tomorrow morning, I actually go in for the consultation and then the operation the same day.
I wonder if he's had a virtual consultation already, assuming he has, but, you know, you don't want to arrive to a whole brand new city and then talk to the doctor or talk to the team and realize it's not something you want to do for whatever reason. I've heard of people doing that too. I knew one guy who went to Turkey and then saw that there were like so many different like treatment rooms in the facility where he was going to get his transplant, so he just literally just ran out of there because he didn't feel comfortable and just took a flight back home. You want to try to avoid situations like that.
I'm super excited, I'm very nervous, but I'm super pumped to get my hairline back. And why wouldn't I want to look as good as possible?
That's the second time you said that now. I think that's part of his channel, right? Is like he's taking guys from bros to chads or something.
All right guys, it's the big day. I'm just at the top of the hotel having my light breakfast.
There's like some fried stuff on there. I'm not sure how light that is. The reason you don't want to have a massive breakfast is because you're getting medications during the surgery. You're laying head down for part of the procedure to get the grafts out. So if you're having a lot to eat there, you might start to feel a little bit queasy, a little bit sick, and you don't want to be vomiting as you're getting your procedure done.
The doctor drew on my new hairline, and then together we discussed it and made small changes until it was exactly what I was looking for.
Okay, I'm looking at these markings. He wrote the number 26. 26. What could 26 mean here? Oh, maybe 26 millimeters from the center is maybe what it means. I'm not exactly sure. He just drew this massive 26. Might be the distance from the center. It looks like he's given him a few options for where he might want the hairline.
All right, guys, so I just put my camera in this locker here. They gave me a gown that I'm going to be wearing.
Oh, did he change it to 25? I don't know. Maybe that's his favorite jersey number. The left side, he's drawn in some temples, and on the right side, he hasn't. So, not really sure what the plan is here.
It's probably the last time you'll see me till afterwards, so I'll see you on the other side.
Unless he has enough asymmetry where they felt that they needed to do some temple work on the left and not the right.
They first used local anesthesia to numb the donor area that they were extracting from. Then they used an FUE punch tool to make small circular incisions around each hair follicle.
You guys know the steps. You've watched the videos that we put up, so if you need to, you can rewatch our whole series, especially the FUE versus FUT video. I think is quite good. Gives you the main options that exist for extracting grafts.
They use a sapphire blade to make microchannels smoothly and create small recipient sites, and then they simply transplant the hair.
Whether the sapphire blade is being used or really any other blade or implanter pen doesn't matter so much. What matters is the depth of the recipient site, the angulation, the direction, and of course the density that's created.
Okay guys, so I just got back to my hotel after the operation, and this is how it's looking.
So it looks like they did some temple work on the left, don't see much on the right. They created a fairly sharp corner. In my practice, I tend to like rounding it out towards the temple. As you get from the frontotemporal area into the temple, I create a bit more roundedness, but they didn't do that. They had this other method. I like the regularity at the hairline itself. I think that's good. It looks like it's really packed in there, so the density seems solid. I mean, this to me looks like probably on the order of maybe about 1,600 grafts, I would put it at, roughly. Maybe a little bit more than that. Could be closer to 2,000. 1,600 to 2,000 grafts, I think, to generate something like this. They definitely worked into the frontal area. It looked to me like his forelock was quite good, but they did some work into the center area too. I'm not sure it would have gone as thick and heavy there, but they felt that it was necessary.
It hurts actually quite a bit. I just took one of the pain pills that they gave me. Hasn't kicked in yet. It just feels really tight, like I have a headache.
The headache is normal, and then eventually he'll experience some swelling coming down the forehead, even onto the face. They left the wrapping for the back to just try to keep it from oozing too much. Oftentimes people walk out without any kind of wrap or bandaging on the back. We find that it really is fine by the end of the day for them to walk out without it.
But yeah, I'm gonna use this little neck pillow they gave me and try to go to bed. And tomorrow I gotta go in and get them to take the bandage off and clean it for the first time and show me how to clean it.
Some places will have patients come back the next day for a cleaning. Again, with proper instruction, we find that it's unnecessary to have people come back the next day, but it's definitely one way to do follow-up care, and it's totally appropriate. He's got the neck pillow, which is a nice touch, and he's sleeping a bit elevated, and that's also important. The reason to sleep elevated is to reduce swelling and to, again, reduce the risk of rolling around and rubbing the area that was just transplanted. You can definitely rub the grafts off in the first, I would say 72 hours.
Just went in this morning to get a cleaning and for them to take the bandages off, and they did a little bit of laser work, which definitely helped my scalp feel better.
The laser work in the early period as you're recovering, I'm not sure changes the overall results much. What will one session of lasering on post-operative day 1 really do for the ultimate outcome? I think very little, but it probably won't hurt either.
Drum roll, please.
So you definitely have to be careful when lifting hats off the transplanted site, especially in the first few days, or putting hats on. Definitely can rub those grafts right off.
So this is the day after the operation.
I'm still just trying to figure out what went on at the temple areas, because I'm seeing maybe some grafts there, but they're very scattered, so I'm not really sure what the purpose was of the temple work, but maybe just some very light grafting there.
That's how it looks from the front. I'll show you how it looks from the back if I can.
So pretty diffuse pattern for the FUE harvest, which is fine. They went up pretty high. Once you're past this occipital protuberance back here, which is that bone, you're pretty much out of the ideal safe zone, and you're going into areas where he could potentially lose hair over time. So if he starts having some crown loss and that starts to expand, well, now some of these hairs came from that area and then they won't quite make it in the front over time. The overall strategy here is to try to have enough grafts for the recipient area to make a difference without really going overboard. So in my estimation, Brett would have needed a much smaller procedure. So I think, well, maybe they'll tell us how many grafts they did, but probably at closer to 2,000. I would have offered him a smaller procedure, probably on the order of maybe 1,200 grafts, 1,000 grafts, something like that, where it would make a nice difference, but it would also preserve his donor hair so he could use it in the future if he needed it. This was definitely a bigger production.
They used a method called FUE and DHI to implant the hairs in the front here. And this is a total of...
We've talked about FUE before, we've talked about DHI before. Make sure to check out those videos.
And this is a total of 2,400 grafts.
So 2,400 grafts, to me, for that area is a bit aggressive. I don't think he needed any hairline lowering down the middle. I think and that's pretty much what he was hinting at.
As you can see, it's coming back quite a bit here in the corners in the temple area.
So I think that it would have been better, in my opinion, to preserve the hairline right where it was centrally and to do some corner work both into the temple and into the frontotemporal area, probably on the order of about 1,000 to maybe 1,200 grafts, to create a nice change without altering things too much and also leaving enough hair in the back to save for a rainy day. So I probably would have done a procedure about half this size. We're always trying to make a nice improvement at the recipient area, but we want to preserve and conserve the grafts from the donor area. Going big and doing more isn't always the best approach.
So how was the operation? The operation, honestly, wasn't that bad.
And this type of strategizing has nothing to do with Turkey or going to another country or doing it in the United States. It's all about choosing the right doctor or surgeon who will guide you through that process of decision making. That is always the most important thing. It's the technical side of it is important as well, but it's less important, I think, than making good, proper decision making up front.
They told me over FaceTime that I would need about 1,400 grafts, and they ended up doing about 2,400, which is 1,000 more, and I'm just like a little bit nervous. I'm like, is that going to be too much?
Yeah, like I said, in my opinion, 1,400 would have been a lot more appropriate for the size of the area that he needed.
I'm just going to have to go ahead and trust the doctors.
And I wonder how their payment was structured. Was it per graft that he had to pay? Was it just the price of the surgery, like a fixed price? Because of course, that could sometimes influence clinic's decision to give you more grafts, right? So that's something to just be wary about. It can be hard sometimes virtually to figure out exactly what someone needs. It's much easier once they're there in person, once you have something at least roughly mapped out, and then you say, okay, you both patient and the team agrees on the area that's being worked on, and then you can get a much better idea of exactly how many grafts. So in my practice, I've actually moved away from per graft pricing and more to a tiered system. Tiered based on complexity, based on overall size, and based on how long I think the surgery will take us to do. So we have a 5-tiered system. And the graft counts now are ranges that I tell people in advance. So I give them a range. It's much less focused on like how many grafts. Of course, ultimately there is a graft number. And I think it's important to have a graft number so that the patient knows if they could then go to another clinic in the future for, you know, some touch-up work, or they come back to us. We want to know how many grafts that we end up doing. But I tried in my practice more recently to separate that and knowing number of grafts from the pricing structure, because I felt that people were too fixated on saying, oh, this clinic charges this much per graft, this clinic charges that much. I don't think the focus should be on that. I think the focus should be on optimizing your result so that you have a nice aesthetic result that's going to be with you for your whole life.
Now, the type of transplant that they did was mostly FUE, which is where they manually make an incision and then take the hair and plant it, which is better for large surfaces that need to be covered. And then a little bit of it was DHI.
No. Wait a second. So we have a whole video on this. A lot of people like to separate out DHI from FUE, but they are mutually exclusive concepts, and we have an entire video explaining this, so please check that out. So FUE is just the extraction method. People who are using DHI, which is an implantation method, are oftentimes just using FUE. In Brett's case, he had FUE, not because he had a large area to cover, as he's saying, but just because they tried to minimize the impact on his donor area. FUE can be compared to FUT, which is the other method to extract grafts. FUT leaves that linear scar. So that is something that a lot of younger guys, don't want to go for. But actually, FUT yields a higher graft count on average and can be used to cover a broader area of a recipient area. Now, that's very different from DHI, which is just one method of implanting grafts into the recipient area. So different concepts.
Which is direct hair implantation, I believe. And that's where they can do it all at once. They can, extract it very quickly, implant it. And I think they use that for the sides here. The top, I think, was the FUE. And this is the more modern way of doing it compared to what your dad or grandpa might have done, which is the FUT, which is where they take that long strip that they cut out of the back of your head and then implant the hairs from there, which usually doesn't work a lot of the time.
Whoa, wrong. FUT works very well. FUT works great, and if anything, historically it took time for people to accept that FUE also worked, and worked pretty much to the same efficacy if it was done well compared to FUT. But FUT was very much the gold standard for a long time, from like the 1990s to about 2010. So for 20 years, roughly, FUT was the way to go, and it produced beautiful results. The only issue really was that linear scar along the back. So guys, if they eventually shaved the back later in life, they'd have this linear scar that was more obvious. But for a lot of people, who didn't shave the back of their head, think like Elon Musk, he has linear scars along the back, but you never really see them because he wears the hair longer. But he has beautiful hair transplant results, and many people are the same. It's not that FUT doesn't work, it's just that over time people tried to get away from that linear scar. Most of these hair transplant experience videos, I feel like what's often lacking is this discussion of medical therapy, and it's just so critical, and I think that it's often overlooked. So we've spent time creating these videos on minoxidil, on finasteride, on laser light therapy, on PRP, microneedling, all these different medical therapies that are almost as important, if not more important, than the actual hair transplant for the majority of, especially men, but also for women too. So don't get so tunnel visioned into the surgical process and which method, FUE, FUT, how many grafts. That's fine, but you have to look at that in the broader scheme of things. You're trying to ultimately just have a nice appearance of hair on your head, right? So in order to do that, oftentimes surgery is not the singular answer.